Alia.
And my name is Hans Lango. Welcome to 2021 in 30 minutes. This is actually the special New Year program where we will take a look at stories that have made the news throughout 2021.
That is absolutely right, Hans. In today's episode, we're going to recap top stories around health topics from all over the world, including from Southeast Asia and Indonesia.
This is certainly a hot topic, Alia, but before we take a look at the stories, we will have one first story. I want to remind you that we are now also available on Foxtel Flash Australia, Macau Cable TV Channel 84, Vision Philippines Channel 58, and also on Air Cable Philippines. Now, talking about health issues, this is certainly the hot topic for the last 2 years. And one of the things that we have been looking forward to is vaccination. And also the first ever COVID-19 jab was given on December 8, 2020 in the United Kingdom. Moving on to 2021, many countries started their vaccination rolls.
Yes, and 1 month after the first jab with Pfizer-BioNTech, UK inoculated first patient with vaccine created by Oxford University and pharmaceutical giant AstraZeneca.
On January 4, Britain took giant step in the fight against COVID-19, ramping up its immunization program by giving the first shots in the world from the vaccine created by Oxford University and pharmaceutical giant AstraZeneca. The development came just under a month after Britain's National Health Service started using a vaccine made by Pfizer and German firm BioNTech to inoculate healthcare workers, nursing home residents, and staffs. On January 13, Jordan began vaccinating its population against the coronavirus. Healthcare workers and vulnerable people were among the first to receive the jab, either with the Pfizer-BioNTech vaccine or China's Sinopharm vaccine. On January 16, India started inoculating health workers. India is home to the world's largest vaccine maker and has one of the biggest immunization programs. But there is no playbook for the enormity of the current challenge. At the start of the inoculation drive, Indian authorities hope to give shot to 300 million people. Meanwhile, on January 18 in Brazil, 2 women became the first people in Rio de Janeiro to receive first dose of COVID-19 vaccine. Brazil kicked off its vaccination program on January 17, applying the Chinese-made CoronaVac to a nurse at a hospital in Sao Paulo.
Well, vaccination programs in many parts of the world have not always been that smooth. As we can see from our previous package that India also started their vaccination roll in January. However, COVID-19 cases started to rise on the country starting on February 2021.
That was right. Yes, the peak was on May 7 where the daily case hit over 415,000 with around 4,000 deaths in 24 hours. At that time, India recorded more than 20 million virus infections, yet the surge started to slow down in June.
India's official count of coronavirus cases surpassed 20 million on May the 4th, nearly double in the past 3 months at a time, while deaths have officially passed 220,000. The real figure believed to be far higher. The undercount was an apparent reflection of the troubles in the healthcare system. Infections have surged in India since February in a disastrous turn blamed on more contagious variants of the virus, as well as government decisions to allow massive crowds to gather for religious festivals and political rallies before state elections. A sick patient laid on the ground outside a hospital in Mathura, North India on May the 5th. Healthcare centers across the country were overwhelmed by the explosion of COVID-19 cases. In the other parts of the country, people waited desperately to refill oxygen cylinders for their loved ones. On June the 1st, Indian Health Ministry said in a press briefing that daily cases have fallen under 200,000, more than 69% decrease from the peak on May 7th. At that time, India reported more than 28 million cases of COVID-19, second highest in the world after United States. More than 330,000 people have reportedly died from the infectious disease. However, experts believed the true figure to be much higher.
And also, of course, regarding what we saw earlier when we talk about the rise in COVID-19 cases in India, we must also talk about the Delta variant. The Delta variant is of SARS-CoV-2, is a highly transmissible variant of coronavirus that has become the most common variant worldwide. This variant was first detected in India in October 2020, which means it arose before vaccination began. It was one of the causes of second wave of infections in India in early 2021, and by April, it was the most common variant in India. Over the course of 2021, it spread around the world, outcompeting all other variants.
Now, Delta is at least 50% more transmissible than the Alpha variant, first detected in the UK. Vaccines are around 50% less effective at preventing infection by Delta than Alpha, but remain highly effective against Delta. Delta was originally called the B16172. It was renamed Delta on May 31st, 2021, when the World Health Organization adopted a new naming system. From India, we are heading to the United States, where on September 17th, an art exhibit opened on the National Mall, featuring more than 660,000 white flags to mark the scale of the coronavirus pandemics in the U.S.
The exhibit is called In America, Remember, and covers approximately 20 acres. The public art installation was created by Suzanne Brannon Furstenberg, a Maryland artist, and ran through October the 3rd. The memorial also spread across a more prominent location along the National Mall and bordering the White House.
Unfortunately, during the winter this year, COVID-19 deaths in the country has soared to over 800,000. Members of Congress gathered on the U.S. Capitol steps on December 14 to mark the grim milestone. Even though we're in the pandemic, we don't always talk about coronavirus, because there are other diseases that are actually one of the sources of the human race of being erased through sickness or illness.
Certainly,
right?
it looks like it.
Yeah, and one of them is actually malaria. On October the 6th, the World Health Organization recommended the widespread rollout of the first malaria vaccine. The WHO General Director Tedros Adhanom Ghebreyesus said the decision marked as a historic day.
Malaria remains a primary cause of childhood illness and death in sub-Saharan Africa. The vaccine has been administered to more than 800,000 children in Ghana, Kenya, and Malawi since the pilot program began in 2019. The malaria vaccine known as Mosquirix was developed by GlaxoSmithKline in 1987, so it has been more than 30 years in the making. While the vaccine was the first to be authorized, it is only about 30% effective. It requires up to 4 doses and protection fades after just months, but the vaccine could still have a major impact.
Health experts cautioned that this is not a replacement for other efforts to reduce transmission, including insecticide-treated bed nets. The WHO will increase the production and distribute to those who need it.
And apparently this goes the same way with the COVID-19 vaccines. The vaccine could only help you that far, but actually the control is actually in you, whether you want to implement that 3 Ws.
That's right. I mean, have you got your booster jab?
No, I haven't, because I don't think that the government is authorizing that kind of booster yet. But we'll get there. We'll get there.
Are you excited about it, though?
I'm so excited because that means probably I can go to move on with other activities, right?
Yeah, and you can go abroad and so on, right?
That is right.
Now, so let's move back to COVID-19 topic. Along with the call to boost vaccinations, some are enthusiastic to protect themselves with the jabs, but many others Well, not so much. We can see this when many protests refusing vaccinations are held in parts of the world.
Now, people from various backgrounds, from teachers to health workers, even took it to the street to reject the mandate of vaccination.
On July the 14th, thousands of anti-vaccines demonstrators in central Athens over plans to make the vaccines available to children from age 15. Under new restriction, indoor catering and leisure areas will only be available to the fully vaccinated, while mandatory vaccination policy is planned for workers at care facilities and hospitals. At the time, just over 50% of the population received at least one dose of the COVID-19 vaccine. Meanwhile, on August 25th, a group of New York City teachers and school union employees gathered outside the mayor's office to protest a vaccine mandate announced by the city health and education departments. At the time, about 148,000 school employees and contractors who work in schools will have to get their first dose by September the 27th or risk losing their jobs. On December the 7th, nearly 4,000 workers, including healthcare workers, protested in Brussels to call for better working conditions and to oppose mandatory vaccination against COVID-19. Belgium has made vaccination mandatory for all health workers starting January the 1st, 2021. Those who remain unvaccinated will be notified of a suspension of their contract and will be temporarily unemployed. From April, workers without a proper justification from their refusal could be dismissed. Some participating in the protest also complained of burnout from strain of increasing patient numbers.
Well, it's like it's never enough that we have all these variants because coronavirus is always mutating,
It keeps
always
evolving.
Yes, because of the nature of its RNA virus that is always evolving. And as we all know, towards the end of the year, we all have seen the emerging of the Omicron variant. The B11529 was first detected in specimens collected on November 11 in Botswana and on November 14 in South Africa.
On December 17, Imperial College London released a study that finds the risk of reinfection with the Omicron variant is 5.4 times greater than that of the Delta variant.
Now, another study published by the University of Hong Kong's Faculty of Medicine said that the Omicron variant replicates 70 times faster in human airways than Delta, but infection in the lungs appears to be less severe compared with the original virus strain.
On December 20, the United States federal health officials said Omicron has raced ahead of other variants and is now the dominant version of the coronavirus in the United States, accounting for 73% of new infections in the second week of December. The United States Centers for Disease Control and Prevention said on their website that vaccines remain the best public health measure to protect people from COVID-19, slow transmission, and reduce the likelihood of the new variants emerging.
Now, we have faced a new threat of COVID-19, which is the Omicron variant. We should not be in despair because the COVID medicines development are underway. On November 14th, Britain became the first country in the world to approve a potentially game-changing COVID-19 antiviral pill, jointly developed by US-based Merck and Ridgeback Biotherapeutics.
Meanwhile, American drug maker Pfizer said on December 14th that its experimental pill to treat COVID-19 appears to work well against the fast-spreading Omicron variant. The company said its study of over 2,000 people found the drug reduced hospitalization and deaths by nearly 90% among high-risk adults. The full results came from those who took the pill within 3 to 5 days of showing COVID-19 symptoms.
All right, Hans, let's now move to China, where medical products regulators said on December 8th it had approved the use of BRII Biosciences. It is an antibody treatment for COVID-19 and the first treatment of its type against the virus given the go-ahead in the country. So, as you can see, there is a silver lining, or perhaps a light at the end of the tunnel of this pandemic.
Well, cross
Everybody
my fingers till it
hope so.
hurts.
Yes. All right, so we have highlights from Southeast Asia when we come back. Stay tuned in 2020 in 30 minutes, only on See Today.
Hello and welcome back to 2021 in 30 minutes. Now, 2021 has been a hopeful year for Southeast Asian countries as we race to hit our COVID-19 inoculation target and reach the herd immunity.
Our team has compiled the journey toward herd immunity in the region and the following story. So let's now have a look.
The Lion City received their first vaccine batch from Brussels on December 21, 2020. Singapore's Prime Minister Lee Hsien Loong received his first vaccine on January 8, 2021. Meanwhile, around 87% of the population is fully vaccinated, with around 31% receiving booster shots on December. As a measure to fully vaccinate their residents, the government has reminded those who haven't received their vaccine will need to pay their own hospital bills for medical issues related to COVID-19. Moving on to Indonesia, President Joko Widodo was vaccinated on January 13th at Merdeka Palace. Fast forward to December, the country's vaccination rate ranked number 5 as the highest number of fully vaccinated citizens, along with other countries like China, India, the US, and Brazil. Over 100 million were fully vaccinated and around 45 million are waiting for their second dose. In Malaysia, Prime Minister Muhyiddin Yassin became the first person to receive a COVID-19 vaccine shot on February 24, 2021. The country is boosting its vaccination rate as the government aims to reopen the economy. Around 78% of citizens get vaccinated on December. In addition, they will start the booster program on February 2022. The Philippines kicked off its COVID-19 vaccination program on Monday, March 1, 2021, which began with healthcare workers in 6 government hospitals. They received Sinovac-BioNTech vaccine donated by China. The country has vaccinated 7.6 million people aged 12 and above by December, or around 34% of the country. Vietnam has administered up to 1.5 million COVID-19 vaccine doses a day, with the country's injection rate ranking 3rd after China and India on November. 77% of the population received their first dose and 60% too, surpassing the target set by World Health Organization. The country's current vaccination coverage rate of at least 1 dose ranked 4th in Southeast Asia after Singapore, Cambodia, and Brunei. The land of white elephants started their vaccination drive later than other Southeast Asian countries. Prime Minister Prayut Chan-o-cha was inoculated with AstraZeneca vaccine on March 16, 2021, but the mass vaccination campaign only started on June, amid concern of dose supply. The condition has been improving, and since October, Thai residents can receive booster shots if they have completed their second vaccine doses.
Well, the introduction of this Omicron variant have been canceling many plans for people, especially for Christmas. In Singapore, they have the VTL, or the travel
That
lane.
is right.
Unfortunately, the government has to freeze some of the bus tickets during December 23rd until January 20th because of the Omicron variant.
And in just counts of months
Yes, that's right.
after they launched the VTL.
Just after a month,
Just
right?
after a month. And of course, 2021 in 30 minutes will be back after the break.
In the meantime, don't forget to follow our social media accounts if you haven't already. We're on Instagram, Twitter, and YouTube at See Today News. Stay tuned. Welcome back to the 2021 in 30 minutes. In our previous segment, we were talking about the malaria vaccine, which is approved by the World Health Organization. Now, talking about mosquito-borne disease, there is also another good news from Indonesia.
Because in September 2021, Professor Adi Utarini from Gajah Mada University, Yogyakarta, became one of the Time 100 most influential people of 2021. Professor Utarini is selected as one of the most influential people of 2021 due to her dengue fever suppression research in Yogyakarta using the Wolbachia method. Later in September, she shared with us her struggle and accomplishment during the research, and here are some of them.
And we are very, very proud to say that the result was 77 reduction of dengue in the areas with Wolbachia Aedes aegypti intervention. And even more convincingly, we have also 86% less hospitalization due to dengue in the intervention area. We hope that our government and also partners involved, the private sector, philanthropists, would be able to take this technology further to strengthen the dengue control program in priority areas suitable for the intervention.
And also speaking about Indonesian researchers, we also had the opportunity to interview the University of Oxford's Jenner Institute researcher, Karina Jo.
She is one of the researchers who enabled AstraZeneca's COVID-19 vaccines to be available globally. She is the lead scientist who designed and developed the vaccine production. Karina Jo invented the 2 tablespoons of cells formula, which became the basis for the large-scale production. Here is her message for the Indonesian youth.
Please take the vaccine so we all can get out from this pandemic, and then keep doing good for others, and then have a high dream. It's like a big dream, but nothing is impossible. So you can achieve anything. So if there's a will, there's a way.
Oh, better listen to what she said. She is one of Indonesia's today hero, don't you think?
Oh, well, in that case, I'm so happy and so proud to see Indonesian can actually shine out there. And also, even though despite all the tools that they are using, they are quite not under the microscope in terms of Indonesian public, because we only knew them from the articles from international media.
That's right. And don't forget, she's a woman.
Yes, that's right.
Speaking about women, and also speaking about AstraZeneca vaccine, there was also a memorable moment at the Wimbledon Championships. Do you remember when the audience gave a standing ovation to the vaccine founder?
Vividly.
Yes.
I remember the audience applauded Dame Sarah Gilbert and the National Health Service UK team when they were invited to the Royal Box at the Centre Court and thanked them for making the tournament possible. The claps gradually got louder as the people stood up to acknowledge the team. The viral video was shared on the official Twitter handle.
Wait, hello, Mr. Spider-Man. What did you do to my partner?
Hey, it's me! It's me!
Oh, your husband.
It's me all along!
Oh,
Hey,
man, I
you
didn't know it's you.
Yeah, it's me!
Oh, there you are.
Right?
Why are you wearing that costume?
Well, you know, the hype about Spider-Man and Tom Holland, and I don't want to miss the hype and also miss the trend.
It's strange that you don't come with MJ, though. Did the doctor do something to her?
Well, MJ got a fever because of the vaccines.
Well, anyway, thank you so much that you're still here with us. So we are using and wearing this costume because we want to celebrate Indonesia's accomplishment in the vaccination target.
That is right.
December 16th, various men dressed in superhero costumes came to a vaccination drive in Kebayoran Baru, Jakarta to entertain kids who just received their first COVID-19 vaccination dose.
On the same day, a similar event was held at Banjaran Elementary School in Kediri, East Java. In this regency, 26,000 children received their first COVID-19 vaccination dose.
The Indonesian government have started the vaccination drive for children since December 14. And on December 15th, over 49% of target vaccine recipients have been fully inoculated. Just let me check whether you're healthy or not.
It's here, it's here, it's here.
Okay, okay, you're mentally healthy.
I'm mentally healthy and also I'm physically healthy because I got myself vaccinated. I'm sure that you have done your vaccination too.
Yes, twice, right? So
That's
we just need
right.
the booster next year.
Of course. All right, that's all the 30 minutes we have for your World News Roundup.
And as we are heading to 2022, let's hope that the upcoming year will be a lot better than this year. May you have good health, lots of happiness, and a great new year.
Amen. And don't forget to always stay tuned to The Sea today as we are going to continue delivering you news from Indonesia, Southeast Asia, and around the world. See Indonesia, see the world, see today. Bye-bye. Happy New Year.
Happy New Year.